Welcome back to 3 News at 5. If you know someone who's undergone radiation therapy for cancer, you know how it's often a long and sometimes very difficult process.
Yeah, those days may be over, however. In an exclusive report, senior health correspondent Monica Robbins tells us how the future of radiation therapy may take no more than a session or two. And one of our local hospitals has the only machine in Northeast Ohio that can do it.
The average length of radiation therapy is 5 days a week for up to 8 weeks. University Hospital Seidman Cancer Center is using new technology to not only shrink that time, but also the disease needing it.
Probably less than 5% of centers in the United States have adaptive radiotherapy.
Traditional radiation requires making a map of the tumor site, then that same map is used for each treatment. That comes with the risk of exposing healthy tissue with radiation as the tumor shrinks. In 6 seconds, the Varian Ethos 2.0 can update the plan.
This machine can get a high-resolution CT scan, a diagnostic quality scan, and we can remake that plan every single day of treatment.
Critical for tumors on organs that move, such as the lungs or in the abdomen.
The more confident you are that that tumor is exactly here and the healthy tissue is at a distance, you can keep that dose substantially lower. So there's been different studies done where actually the side effect profile is significantly lower with this adaptive approach.
How many treatments will a patient need?
Almost no patient will receive more than 5 treatments. So it's usually between 1 and 5 treatments is what we give.
Yeah, you heard that right. 1 in 5 treatments. This machine can treat cancers such as prostate, lung, breast, pancreatic, liver, head and neck, bladder, and gynecologic cancers. But it's not limited to just those because treatment sessions are shorter and more targeted. Dr. Spratt says there's no real difference in cost because the machine can treat many more patients than a traditional therapy in a day. So they're breaking even here.
This is revolutionary.
It is.
Chills.
Yeah.
Big news.
So for somebody like me who has to have, you know, an MRI and potentially radiation, I'm looking at 6 weeks, 36 rounds potentially.
Wow.
And, you know, if this could cut it doesn't necessarily work on something like I have, but for other people who may need it, this is a game changer.
Big news.
Yeah.
All right, Monica, thank you.
Sure.